Welcome back. It is the DMV Weave Doctor, located right here in Bowie, Maryland, honey. Am I live? Am I live? Am I live? Am I live? Okay. Welcome back. Ciao, ciao, ciao. And today, honey, dolls and gents, we're going to be talking about tips for traction alopecia. Okay, honey, and this is something that, when you're going to your hair replacement and custom wig specialist, you can keep some of these things in mind, okay? We trying to save these edges in 2025. Gotta save these daggone edges, okay? So the wig doctor is just going to briefly discuss what is traction alopecia. And this a lot of people receive. Yes, welcome black, yes, okay. A lot of people, African American in particular, women and some men are complaining about when they go to certain hairstylists, they receive tremendous amounts of traction alopecia after getting certain hairstyles. Okay, and some of the biggest offenders, I would say some of the most, especially that's why the weave doctor has stopped doing the complete glue in 27-piece quick weaves. Now, there are stylists who can do this effectively. However, I'm learning that a lot of people who wear this hairstyle, they are wearing this hairstyle entirely too long. These hairstyles are only posted with 27-piece hair, only supposed to be lasting about 2, 4, maybe 5 weeks max. And so we have people wearing these different hairstyles. They're not shampooing it. And I know you guys, I do a lot of reaction videos as well. Some of you guys are seeing the excessive amounts of like dirt, debris, sweat, all caked up in the scalp. Because some people are wearing these quick weaves for a long duration of time. I mean, like 3 and 4 months. I've seen them on Instagram and on TikTok where people they cannot even remove it. It has like officially locked to the head. Okay. And so when you do not take care of your hair properly, it can lead, leaving in the style too long. And I know some people, we like to use this term in the hair world. Girl, I'm going to stretch my hairstyle. Okay. And that is something that needs not to be done. Most hairstyles need to be removed at least every 8 to 10 weeks. After you start leaving it in past 12 weeks, 4 months, you're starting to get on very dangerous territory, okay? Especially if you're using adhesives and if you're using any types of glues. Glues need to be removed from the scalp. A lot of people also don't realize is that glue and adhesive, it can actually make your skin more sensitive and you can develop eczema and psoriasis and other different type of scalp sensitivity conditions because it's like not being hygienic. Imagine if you were to leave makeup on your face for 2 and 3 months. Okay, what your face gonna be looking like? Okay, and our scalps mimic a lot just like our regular skin. So if you know that you cannot do this to your face for long periods of time, then you should apply that same rule in a lot of cases to your scalp. So that is just something that is very, very important. We have so many people. Another style that people leave in too long are extensions and braids. We've seen them again. Look on TikTok. That's why I like to do all these reaction videos where I'm look like I'm joning or having fun talking about, the pros and cons of getting some of these different hairstyles. But child, I can't recall to you how many times I have seen so many people. Now, this one not just in the African American community and other communities too, where they have left their hair extensions in for 6 months or even a year. And this is just completely ridiculous. And a lot of people think they are saving money when they're doing this. You might be saving money, but you are yanking out your hair. Okay. And again, the hair is not been, I don't care if you have straight hair, ultra kinky, 4C hair, biracial, curly hair. Hair is not meant to stay in those braids over, like I said, 8 to 10 to 12 weeks. Even though I know they have all these different types of methods out now where you can leave different extensions in for 4 months and 3 months and things like that. If you do, you have to be very, very mindful that you are keeping up with your maintenance. And if you are somebody who has very fine hair or dealing with alopecia, you may need to come back and get your installs done more often because of the fact that you're dealing with a fine textured hair that is now receiving excess amounts of heaviness on your scalp. Okay. So these are just some things to really, we really have to look into this, getting these extensions. And it's sad that people are now marketing this concept to clients where if okay, yeah, you can leave this hairstyle in for 6 months or a year. And and I've seen now there is this one lady online. She does say you can leave a sew in for 6 months, even though I really don't advise that. But she has a very specific method, and so that's the thing, And so sometimes if somebody finds a way to get a trick by, that's cool and all. But if you are not able to do the exact same regimen as that person or hairstylist is subscribing to, you are more than likely, babe, to be walking around here, with traction alopecia and balding after receiving a bad hair service that was left in too long. And another thing, as a former or somebody who's pretty much works as a natural stylist, I'm not a full natural stylist like I used to be. I used to do everything. Now I just focus on primarily my hair loss and extension clients. Some clients, if they've known me for years, I have a couple of those clients who I may still do their natural hair. But as you know, even when you're working with natural hair, you cannot let your hair, they teach you that when you're doing locks, when people are getting like those little prerequisite, I call it prerequisite. Those would be like a punchline back in the day in the DMV area. You getting like those gel twists and things like that. If you leave that style in past about 3 to 4 months, with some individuals it will start to lock. With some people, it can start locking and matting up in 2 months. Okay, and so you have to know your hair, and that's why it's good to follow the weave doctor's rules. Make sure if you're getting these braid and extension styles, you are shampooing, every 2 weeks, the max 3 weeks, and especially if you're exercising and working out, sometimes you have to do a rinse so that, a lot of people don't realize that those salts and sweat actually break down the hair fibers and not just the weave fibers. A lot of y'all being smart, but the actual hair that is underneath the netting. So these are just some things to consider. Another thing, now I've seen a lot of people wearing the ponytails nowadays. I think nowadays they're doing it a little bit more healthier than what we were doing back in the days, using all those excessive amounts of bobby pins. Woo, child, I swear some of us must have had like 75 or 90 different bobby pins in our hair just for one pinup. Okay. And even those, if not done properly, if it's too much pronounced in certain areas, it can lead to ripping out that hair, making it weak in certain areas. So but now they have this ponytail method with the two frontal method. I've seen. I'm probably going to take me another. I try to keep taking classes. I'm going to take me another class on that, and there's another closure, glueless closure install. Now that one won't necessarily be for alopecia class that I'm going to take, but they have a lot of different methods of doing these ponytails now that do not require a lot of excessive amount of gels and glues and all this type of stuff like we used to do back in the day. All right. But these are just some things as far as traction alopecia, especially with the tight braiding. Now, me, as I do hair replacement and wigs, I always suggest to my clients it's good to go glueless if you can. Also, they have, you might want to opt and tell your stylist, I don't want the thin, they have like those little, you may not be able to do all the trends if you're trying to keep up. If your most important thing that you're concerned about is keeping your hair on your head, okay? So, for example, they have those HD caps that are out, that everybody wants to put underneath their wig for the install. However, the glue seeps right through it, okay? And that kind of prohibits the whole situation where you're trying to save your edges. And we have to sometimes get over the vanity of everything. Okay, if you get those HD caps, yes, it's going to make, especially if you're getting an HD lace or anything like that, or all that other type of stuff. Yes, it may look less visible, but what is it doing to your edges? Okay, and so these are just some things that people we got to realize, and it's good for hairstylists and trichologists to educate the clients on that. Originally when they had that old thick stocking cap, okay, honey, how many of you guys remember that big old thick stocking cap that people were putting underneath their wigs and weaves, before they got this HD one? That one actually, to me, really, really helps from keeping the glue and the gum getting directly on the hairline. Another trick too is to put the adhesive a little bit lower than your actual hairline. Now, we're not trying to have you look like cousin Ed out here in these streets, but you know that. With that being said, if your hairline is right here, child, and somebody's got a big forehead, like the weird got a lot of forehead to spare, you might be able to put. Now, we're not trying to give you the tired bangs, give you a whole different hairline, but it might be advisable if you're going to be wearing adhesive to maybe go down at least in half an inch. I remember there was actually this other method that I learned. One of my clients, she wanted to make sure that the adhesive um, used the least amount. We use the least amount of adhesive touching her face and scalp, and we actually figured that out. Because this individual woman, she had been wearing, these different wigs and hair replacement systems for years, and we actually came to a conclusion. If you guys want to figure out that, make sure the book with the weed doctor. I'm going to put my link tree in the comment section. So there are a lot of things out there. We even have got to be the sprays. Now the sprays can be a little bit harsh, but they have those gels and things like that can be used as well. So we got a lot of different options out there if you want to save your edges. The main thing is that we just have to keep making sure that we're keeping health and the longevity of our hairline first, and not focusing primarily on the aesthetics or the looks of the install. And that's the thing about a lot of the different things that are, we have to be careful watching YouTube and Facebook. We're looking at the aesthetics. Oh, did you see the new hairline? Did you see this? I want my hairline to look like that. And that could be possible. However, now that we're somewhat switching, for example, if you get an ultra plucked hairline on your lace front or your lace unit, baby, you have to replace that frontal quicker than as you would if you would not done all that extra customizing. So however, the more work that you put into that frontal, the more natural and flawless that hairline is going to look. And typically for me, I've seen some of my best installs have been with the ones with adhesives, with the tape. But it's something about the adhesive, using that. And so that's why the weave doctor on our next order, we're going to be getting like, and we've been talking about it already, but they have a minimal order requirement when we order some more adhesives and stuff. Some adhesives that are like safe and friendly for those who may be dealing with any type of cancer, skin sensitivity, or anything like that. Now, the next form of traction alopecia can come from chemical damage. That's why a lot of people have stopped getting those relaxers. Remember back in the day, and some people are still doing it, which I don't know why, especially because now they have closures and they have stylists who can install closures to mimic almost like your natural hairline, you know. And so, with all that being said, they are now, back in the day, we used to put excessive amounts of relaxer. Even myself, and I have very soft, wavy, curly, fine hair. My hair cannot withstand that. Child, I remember one time I over processed my hair because I had just moved out here to Maryland. Child, my hair had broke down to a nub. Okay. And my leave out hair was pretty decent, a nice, very, very long length. And so that's another way how traction alopecia can occur. Like using too much bleach, excessive amounts of bleach, using all of these relaxers, we got some people out here, child. They are relaxing their hair every 3 to 4 weeks. Okay, baby, and that's not going to get you nothing but bald and just, in most cases, years of doing this, your actual hair is going to thin out. Now, there are some stylists from back in the day, they were able to do these things without over processing the hair. But I find that sometimes the work ethic has really declined in some of the salons nowadays. People are not, a lot of people are not licensed, and so they're applying these different type of hair treatments and chemical treatments to people's head, and they're not doing it in a manner where it's actually saving the actual person's hairline. Okay, so child, just make sure that you are watching out for some of these things. Okay, now since we're talking about traction alopecia, we're going to give a quick tidbit. We're going to get your trichology treatments by your certified trichologist, by the weave doctor. Okay, we're going to talk about just briefly, we offer the low light laser therapy. So if you come in our hair loss clinic and office, you are going to get this laser treatment, okay, honey? And some of these lasers, most of them are US FDA approved, especially the ones that we use. So it's already been proven through the FDA that these types of lasers with a certain amount of diodes and stuff that we learn in trichology school can help regrow the hair. All right. So most of the people who've received this low light laser therapy treatment, they have received 100% increase in hair growth. All right. Even the hair count has increased. Okay. So these are just some things to look at. I'm just going off of the facts. Okay. And they said 93%, this is a controlled clinical study. 93% of people got an average of 19 new thick hairs per centimeter. And so that's the thing about it, where a lot of people, and sometimes that's why you go to a trichologist. You got to make sure that you're letting your trichologist get your scalp analysis. Because sometimes if you have severe amounts of alopecia, baby, you ain't gonna be able to see no daggone 19 hairs per centimeter, okay? So that's when you have to rely upon a different type of devices that a hair loss practitioner has, okay? So it's a lot of different things with this. Also, it increases circulation to the scalp. These are one of the reasons how your hair can regrow back. Okay. If you do not have any blood circulating in that area, then the follicles are not going to be able to be strong and not going to have a nice, thick, full hairs. You're going to have the little vellose baby hairs. Okay. So these are just some different things, because a lot of people, when we're getting some of these treatments, people be talking trash. What's that going to do for me? Is that even going to work? This is just a waste of time. And so with trichology treatments, we are not claiming that we are curing your alopecia indefinitely. It's just, for example, like getting a facial for your scalp. Okay, child, the weave is all jacked up. Okay, there you go. It's just like getting a facial for your scalp. Like I just got a facial, what was it, like a couple of days ago, and I'm about to give me a back facial too. Okay. And so, like, for example, with the trichology treatments, a lot of people, this is just a misunderstanding. Some people feel like, oh, well, if they gonna regrow my hair back tomorrow, I won't have all my hair back. And if I don't see all my hair growing back, I don't want to come no more. Okay. And some people they have that type of, I guess, attitude. So the thing about the hair loss treatments, now, of course, like we said earlier, you're going to be seeing a gross amount of hairs per centimeter. And a centimeter is about, if this is an inch, 2 fingers, then it's about this much. So they say you're going to be getting 19 new hairs. So, baby, if you only had 3 or 4, you're going to be filling it up. Okay. And so, but, so that's just one of the perks of getting the hair loss treatment. Now, is your hair going to be the same centimeter density and fullness that it was when you were 20 years old? Probably not. Now, we've had some rare cases, and those were, Now that may not be for everyone. Those individuals, they had COVID, the coronative. You got to be careful saying different words on social media. They had like the Rona type of hair loss. Excuse me. So there's certain situations. We had another client. She had that. Then she was just dealing with stress. Her hair was falling out from that. Okay. So these are just some things to look, you know, so that was a type of hair loss that we were able to really recover it back. We've seen others too that might have supposedly dealt with CCCA in certain situations. But again, these individuals, they were coming back pretty frequently, and they were following the program. Now, ultimately, for all those, I will say to get the most phenomenal results, you got to change that diet, okay? And to get the hair mineral analysis, see what you are deficient in, okay? And once you start to address that and start to eat a lifestyle that does not exacerbate already your comorbidities that you've already have been diagnosed for. Like, for example, the weed doctor was told by a crazy doctor that my sodium was low and that I needed to increase my sodium and eat out. Why come did I get a gout about 7 or 8 months later? So now before, when I was like maybe 7 years ago, I did not get all the tests ran. So this time I got the test ran. All right. And we figured it out that it was pretty much gout. So I go to a rheumatologist maybe every couple of months. But baby, he's about to get ditched, okay? Because I am going back. I tell people on my fake Dr. Sadie diet, and I'm going to only be eating out, 1 to 2 times. Sometimes I may eat out 3 times a week, but that's going to be more on rare occasions. But for example, for me, I know that I have this situation going on. So, is one of the biggest contributors to this situation is eating foods high in purines and eating high fructose corn syrup. So if I know that I know this already, and I refuse to listen, and I keep going on this type of situation, then I'm gonna keep dealing with leg swelling, possibly discolorations on the leg, all these different type of crazy issues. Okay, so that's what I mean by that. So like for me, the weave doctor is going to go back on her more stricter plant-based diet. Also, I'm working with a holistic practitioner for acupuncture because we're trying to find out is stress that's causing some of these situations, or is it that my body has just got so clean, which I have, pretty much changed the diet and everything as far as being holistic. So those chemicals that's in the regular food may really, really exacerbate and just, may not even, really be adding fuel to my fire because I'm not used to eating that type of food. So, but that's why it's good to work with a practitioner such as myself and have multiple practitioners so that you can, because not just I do the trichology, I also have multiple certifications for a holistic practitioner. And I use pretty much my holistic work for regrowing the hair and helping to reduce some of the different type of health conditions that can come along, from eating improperly and that which can worsen your alopecia. Okay. So, so that's my thing that I'm doing with the gout situation, the inflammation in the joints. So, if you were someone that had diabetes, would it be a good idea to be eating cake all the time? Okay. Or eating high, what is that, fructose corn syrup, eating a lot of snacks and candies. That is a main contributor to, alopecia as well. A lot of people that suffer from diabetes, they can deal with alopecia, okay? Because what it's doing, as like with most of these conditions, it's messing with your arteries and it's constricting blood flow. And when it does that, you're going to be constricting blood flow to the scalp, okay? And when that happens, you're going to start to mess with how your scalp and hair follicles can receive oxygen and nutrients. Okay? So these are all things that we have to look at. Once you find out what type of health problems you got, you have to eat accordingly to help reduce that so that, and a lot of these medications that treat it also cause alopecia as well. So that's why we need to work with a holistic practitioner. You got to work with your trichologist. We got to make sure, like we said earlier, just wrapping things up. You got to come back in a timely fashion. You cannot be waiting, 3 and 4 and 5 months before you come back to get your hair done. Okay. So these things to look into. Also, making modifications for your alopecia. Do not try to always get the most top trendy styles. If you are not going to, that's not going to be your main focus. Your main focus is trying to regrow the hair and to preserve the hairline that you do have. So you may want to go for certain options that may not give you the most high end, top flawless result, but gives you a decent result, just in order so that you can preserve your hairline. All right, but thank you so much for you guys for tuning in, child. The Weed Doctor that had a long day. I enjoyed myself. I got treated today and had a lot of fun. All right. So we hope you guys have a wonderful evening. I'm going, speaking of gout, I'm gonna take, because I'm trying. What did the Weed Doctor eat today? Now this week I couldn't take it no more. I was tired of eating that chicken. I'm gonna start clucking like my mother said if I eat one more piece of chicken. So, but I had to get me like some medium fried Indian chicken. Okay. So I had me some namaste. Today I was being greedy, child. I had vegan food, which I think you got, and that's something we got to watch out. Not everything that we eat that appears to be healthy is healthy. Don't you know? The minute I started eating that, I felt a little bit of slight pain and irritation in my ankle. Okay. And it just shows us we have to be monitoring what we eat. So I ate that. I ate a couple of bites of that. I threw the rest of that lasagna away. I said, no, no, the devil is a lie. I am not going to be dealing with this type of pain. So I threw that thing in the trash and then I just went ahead and went to the Caribbean place. Even though I got a nice little amount of it, but a lot of preservative foods cause a lot of these health problems too. So I just went to my Caribbean restaurant and they got something that I love and enjoy so much. And I think it's pretty healthy overall, unless maybe you have high sodium. As you hear, the weed doctor got the complete opposite. So, in some moderation, is not too bad for me. So, baby, I got me a Caribbean chicken soup, and I tore that whole. Was it 16? It must have been more than 16 ounces, maybe about 22 or 30 ounces worth of soup, baby. I chuckled that thing down and took it like a champ. Okay. All right. Well, I hope that was some good tips for how to avoid, getting traction alopecia. If you have any ideas for the show, make sure to email inbox the weed doctor or leave it on the in the comment section to see if we can talk about any of the different topics. All right, it's been a fabulous time and a fabulous show. The weed doctor got to go. See you next time.